One of the biggest questions around Social Security and from seniors right now is, can I work while collecting Social Security? The answer is absolutely. Yes, you can. However, there is definitely some information you need to know about this before you just jump into working that I'm going to break down for you here in this video, because if you earn too much money, you're going to see a massive reduction to your monthly benefit, and that would be a little bit counterproductive in my opinion. We certainly don't want to see any reduction to our monthly benefit. Therefore, I'm going to break it all down for you here in this video and let you know all the information you need to know about this, and again, how this pertains to many seniors that are out there. And here's what I find to be interesting about this. Considering how many people are asking this question right now, it makes me really think that there's a lot of seniors out there that are possibly struggling on their Social Security monthly benefit because the cost of living has increased so massively, as in it's getting so expensive to pay rent and utilities and the mortgage and food and everything else that we're all paying for. And our monthly benefit checks are falling so far behind right now that I've seen it down below in the comment section. A lot of seniors are reaching out saying, I need to start working. I need to work part-time or full-time, or I need to do something to generate income to pay the bills. Sad situation. Nobody should have to do this. If somebody's in their retirement, they should not be forced to go back to work to make ends meet. I mean, you can if you want to, just to do something with your time, but it should not be out of necessity. It's a sad situation right now, but unfortunately, this is the reality for way too many seniors. But I want to make sure that you're doing it right and that you're not seeing a massive cut to your benefit in types of situations that certainly happen to a lot of people. I don't want you to learn this the hard way. Anyway, let's get into it and talk through the details. Now, if you're watching this video right here on Social Security, I would anticipate you're probably already enrolled in Medicare, or you will be enrolling in Medicare soon. If that is the case, please do yourself a huge favor. Take advantage of that phone number right there. It is a 100% free resource. They've already helped about 5,000 people right here in this community, making sure that you're properly covered and you have the best plan for you and your personal situation. Remember, Medicare only covers 80% of your medical expenses. You're on the hook for the other 20%. A lot of people don't realize that. Please do not get stuck with a massive medical bill because you were improperly covered. Seriously. Call that phone number. It is 100% for free. They will look through the 20,000 plus plans that they have at their disposal and find you the best plan at the best price with the best coverages and the best fit for what you personally need. And remember this much as well. About 60% of the plans are a $0 monthly premium, and a lot of times they have extra benefits to go along with them. Really cool stuff. Sometimes grocery allowances, sometimes extra over-the-counter benefits, all kinds of cool stuff that comes with it. Anyway, call them right there. It's 100% for free. They're waiting to help you, especially with annual enrollment right here. Take advantage of that. Seriously, 70 million seniors will be contacting them. Just give them a call and just see what they can find for you. It never hurts to ask. That is my motto in life. Always ask, because you never know what you're going to get. It's nuts how much I get by simply just asking. You got to ask all the time. Anyway, it's a free resource for you. Give that phone number a call. If you're currently on Medicare, or if you will be enrolling at some point in the next 6 months or so, call them, especially here for annual enrollment. Take advantage of that. By the way, after you talk to them, drop a comment down below. Use the word chapter within your comment and let me know how it goes. I'd love to give you a shout out and feature you in an upcoming video, just like I've been doing for so many people in other videos recently. All right, anyway, let's talk about Social Security and the earnings limits and things like that you need to know if you are going to be working while collecting your Social Security benefit. Now, I want to point this out. Working while on Social Security is absolutely something you can do, okay? There's no rule that says you cannot work, you must do nothing on Social Security. No, there's no rule that says that. You can. You just got to know the rules of the game, okay? I'm going to tell you the rules of the game so that we don't accidentally see any cut to our benefit, anything like that, okay? So yes, you can. It is not required. That's another question that I want to answer. It is not required. You do not need to work on Social Security. You can if you want to. You don't need to. All right, so here's a couple of things I want to point out. You need to know this. When did you file for your benefit, and where are you currently in age in relation to your full retirement age, okay? Now, what I'm talking about here is in regards to Social Security retirement benefits, spousal benefits, these types of benefits, okay? If you are an SSDI, Social Security Disability Insurance Beneficiary, these numbers do not apply to your benefit. I have dedicated videos on the channel talking about that. These numbers do not apply. For SSDI, Disability Beneficiaries. If you're an SSI beneficiary, Supplemental Security Income, again, these numbers do not apply to you, okay? I have dedicated videos here on the channel talking about that. This is just retirement beneficiaries. Again, retirement spousal beneficiaries. Okay, so here's what you need to understand. What is your age right now? You don't need to leave a comment down below. Just think of this for yourself. What is your age right now in relation to your full retirement age? You need to know your full retirement age. Remember, your full retirement age is based on the year that you were born. For example, somebody born in 1960 or after has a full retirement age of the age of 67. Somebody born in 1959 has a full retirement age of the age of 66 and 10 months. Somebody born in 1958 has a full retirement age of the age of 66 and 8 months. Okay? And the list goes on and on. You need to know what your full retirement age is. Next question being is this. Are you before your full retirement age or are you after your full retirement age? And are you going to be achieving your full retirement age this year? Okay? You got to know the details of that. So if you are 67 or above in age, you're good. You'd be after your full retirement age. If you are, say, 62 to, say, 66-ish, you're before your full retirement age. And if you're going to be achieving your full retirement age, as in 66 and essentially 8 months this year for most people, then you're going to be achieving your full retirement age this year. Does that make sense? Okay. Let's talk about those people basically between the ages of 62 and 66. This is the first category. You fall into the age group of people that have filed for their benefit. This is, by the way, this is assuming that you are already receiving your Social Security, okay? Assuming that you're already getting your Social Security benefits. If that's the case, this applies to you. Okay, if you're between those ages, about 62 and 66, roughly, okay? There's obviously a little bit of play here, but just between those ages. You fall into the category of somebody who has applied for your benefit prior to your FRA, your full retirement age is what that stands for. In this case, yes, you can absolutely work, you can absolutely have an income. However, there's an income threshold. Please be aware of this, otherwise you could see a garnishment to your benefit. You can earn up to $1,950 per month or $23,400 for the entire year with no garnishment to your benefit. So if you want to, go at it, earn that much if you want, okay? But if you earn over that threshold, please recognize this. You will then see a garnishment to your monthly benefit of $1 for every $2 that you earn over the limit. Example being this. If you earn $1,000 over the limit, you will see a garnishment of your benefit by $500 gone from your benefit. Does that make sense? Okay, please be very, very aware of that. Now, is this gone forever? No, it's not gone forever. You will get it back after you achieve your full retirement age. They will slowly feather that $500 back into your benefit, but for now, it's going to be gone for a while, okay? You don't want to see that garnishment because, like I said at the beginning of this video, it would be a little bit counterproductive if you're there working to earn income and they're garnishing your benefit at the same time. Doesn't make a whole lot of sense to me, all right? That would not make any sense. You're out there grinding and working to make some income to live your life, and all of a sudden they're taking your benefit because you're earning too much. I don't know. Doesn't make any sense to me whatsoever, okay? Please be very aware of that. Now next, category number 2 is those individuals that will be achieving your full retirement age this year in 2025. By the way, I'm filming this video kind of late-ish 2025 right now. So if you're going to be achieving your full retirement age this year, 2025, this is generally those people that were born in 1958. Not everybody, generally people born in 1958, okay? If this is your situation, then you would also have an earnings test, but it's very, very different. You can earn up to $62,160 in the months leading up to your full retirement age month. You can earn that much income leading up to that time frame. It's a lot more income, $62,160 leading up to when you hit your full retirement age, okay? Now, if you earn over that income threshold, first off, congratulations, you're earning a very nice income. But number 2, you also need to recognize you will see a garnishment to your benefit by $1 for every $3 that you earn over the limit. Example, you earn $900 over the limit. You're going to see a garnishment of $300 to your benefit, okay? Is it gone forever? No. Temporary. You will see it feathered back into your benefit after you've achieved your full retirement age, okay? That's what that's all about. Now, group number 3 is you entered the year at your full retirement age. In other words, let's just say, for example, your full retirement age was 66 and 4 months. Okay, if that's the case, then you have entered the year 2025. That's when I'm filming this video right now, so that's what this is relating to. You entered the year already at your full retirement age. What is your earnings limit? As much as you want, or as little as you want. Doesn't matter. You can earn as much or as little as you want. You have no limit whatsoever. Once you've achieved your full retirement age, you have no limitations whatsoever. Okay? Nothing. No garnishment to your benefit. No limitations. You are totally good. You've got nothing to worry about from an income standpoint. Okay? Does that make sense? So the simple answer, like I said earlier, is yes, you can work while receiving Social Security, but you got to know which of the 3 categories you fall into, whether you are before your full retirement age, achieving full retirement age this year, or you are already at your full retirement age, and then insert the corresponding dollar amounts that you can earn and the corresponding garnishments to your benefits as well if you earn over those limits. Okay? There you go. That's the simple answer. Now, I said this earlier, and I'm going to say it again. If you are an SSDI, Social Security Disability Insurance Beneficiary, you have significantly different income thresholds. Do not use these numbers. If you're an SSDI beneficiary, that'd be bad, okay? These are not your numbers. I have dedicated videos here on the channel talking about your dedicated numbers as a disability beneficiary. Look at those. Otherwise, drop a comment down below. Let me know, and I can make a new dedicated video for you if you would like. Same goes for SSI beneficiaries, supplemental security income. This does not apply to you whatsoever. Drop a comment down below if you want me to. I can make you a new dedicated video, no problem whatsoever. And lastly, if you're watching this video here on Social Security, I would anticipate you're already on Medicare or will be enrolling in Medicare soon. If that's the case, take advantage of that phone number right there, 100% for free. They will help you make sure that you're properly covered. And again, I said this earlier, Medicare pays 80%. You're on the hook for the other 20%. If you do not have additional coverages along with your Medicare, as in a supplement plan, a Medigap plan, Advantage plan, something like that, or even a Part D plan to pick up the slack of the 20%, you have to pay for that. You don't want to pay for that. Put that burden on somebody else called another insurance provider. Call them. They will help you get set up, and they will do that for you, get that established for you, okay? Now, some other people are worried and say, oh no, I don't want to pay hundreds of dollars a month for a supplement plan. Well, I don't know your situation, but you don't necessarily need to. Like I said earlier, 60% of Advantage plans have a $0 premium, and they also have a lot of additional benefits along with it, like OTC benefits, grocery allowances, free gym memberships, and the list goes on and on. I don't know what's best for you. Call them, and they'll be able to figure that out for you. Seriously, take advantage of free resources, please. What is free anymore these days? Let's say it together. Nothing. Nothing is free anymore these days. This is like one of the last free things that's out there. Take advantage of it. Seriously. They will help you. They're waiting on standby. Amazing, very knowledgeable, very professional, incredibly kind and helpful team. They will take care of you completely 100% for free. Give them a call, especially here for annual enrollment. You could, if there's one thing you could possibly do for yourself, do that. Seriously, they will save you so much time, so much frustration, so much confusion, and they'll save you a ton of money as well. Seriously, about 5,000 of you here in the community have already called them, and the average person in this community is saving $1,100 of average savings. That's incredible, of money that they didn't even know they could be saving, and they are, because they made a quick 5, 10, 15, maybe 20-minute phone call to them right there to get some free help. Take advantage of that. All right, anyway, please share this phone number, well, that phone number I mean, Please share that phone number with anybody you know currently on Medicare or going to be turning 65 soon. Otherwise, please share this video. Big share button right down below, 100% free. Please subscribe. If you're new here, 100% free. Subscribe down below. If you'd like to, drop some comments down below. Let me know what I can answer for you or where you would like to see some dedicated videos or live streams. I can certainly do that for you. Otherwise, check out the other 6,000 videos here on the channel in the video library. Down below in the description, I've hand-selected some popular videos for you. Check those out. Down below at the top of the comment section, I've pinned a comment with some popular videos for you there. Check those out. Call that phone number. Let me know how it goes. Use the word chapter in your comment after you talk to them. And comment on any video. Let me know how it goes. And I'd love to give you a shout out and feature you in an upcoming video. Otherwise, until next time, enjoy your day. Take care. Have a good one. And I look forward to seeing you again soon in the next video.